So thank you to Dan and John for inviting me to come here today. It was 9 degrees when I left Albany yesterday. So I was very happy when I landed in Fort Myers yesterday and saw the sun and it was warm and I could take off my many layers of clothes and enjoy the sunshine for only a couple days, unfortunately. But I'm happy to be here. To say that I'm impressed with the work and the progress that ARCHway has made and the foothold in the community in such a short period of time is pretty remarkable. But I have known Dan and Jan forever. Basically forever. I don't remember not knowing them. Our mothers were in the same bridge club for 30-some years, and our parents were good friends. So we've known each other pretty much our entire lives. And like many of us, you kind of lose touch with people. You know, as your lives change, you move, your careers change, your kids are different ages. But we always had a touchstone in that we also have cottages in the same area up in Georgian Bay, Ontario. So despite our distances, we would usually run into each other in the summer. And a couple of summers ago, was it 5 years ago?
Yeah.
Okay, 5 years ago, happened to be my wedding anniversary. Not that that has anything to do with anything, but we were at some friend's cottage, mutual friend's cottage, and Dan and I started just chatting, catching up, and he told me about John's recovery journey and where he was. And a couple of impressions I had immediately is, one is I know how hard that was for him to say that. Because we hadn't really talked about his kids are older than mine, and we really hadn't intersected in that part of our lives much. And I just kind of stopped for a minute and I said, do you know what I do for a living? And he said, I don't even know if you work. We're working on becoming a feminist, but you know, it's a lifetime project. But I said I work in the area of substance abuse and behavioral health. And so it just seemed like at that moment it was the conversation was meant to be, and that we, of course, from then on, we haven't really stopped talking about the challenges for families and for friends and colleagues and employers and really everyone who's touched by the behavioral health crisis. Right now it's opioids in many communities, but there are other drugs that are still challenging communities, like methamphetamine, cocaine, and others. So it is a crisis in many, many communities. And the word community is really, really important, I think, for understanding what I believe to be the pathway out of this. It really does require communities to come together and solve the problems that fit their community. You know, there's not a cookie cutter program, there's not a cookie cutter policy. I have one of the best jobs, I really feel like I have one of the best jobs that anyone could have. I get to travel all over the United States and go into communities and find out what they're doing, what works there, sometimes what's not working so well, and how we can help bring some best practices into the community to move them along a little bit, because everybody wants the same thing in the end. I mean, they want to address the addiction issue, which for many, many people, not everybody, but for many people, there's a long history of trauma that's underlying that addiction. Sometimes there's mental health issues that are co-occurring with the substance use. But for everyone who is in that behavioral health system, they have a story of how they got there. No one wakes up one day and decides they want to become an addict or want to be addicted to anything. And that's just, it's a story of how people got there. There's a road to that end, and there's a road back. But it really, I believe, and I think the research is pretty clear on this too, it requires communities to find out what works for them. Resources vary dramatically. If you're from a big city, if you live in a big city, but there are many, many, many resources. There's every profession you can possibly imagine. There may be a wait list, but there at least are there. In rural areas, there's almost no services available for people. And if there are services, there's no public transportation. And so it really requires communities to understand that and to fill those gaps, because those are often the gaps that grants can't fill, Medicaid can't pay for, insurance won't pay for, is how people can actually begin or take that first step toward their recovery. And so it really requires communities to sit down and decide where their strengths are and where their gaps are and find out who can fill their gap for them. We've done a lot of work in a lot of communities, a process called sequential intercept mapping, and maybe some of you are familiar with this in work that you've done, but it requires really all the stakeholders that have anything to do with, in this case, let's say addiction services, to come together, from the people who are on the other end of the 911 call to the people who are managing people on reentry once they leave the jail, whether it's probation or parole if they're coming out of state prison. Everyone sitting down at the same time and deciding how we're going to fix this and how we can all make a contribution. Because what I always, and I hope I'm not outing anybody by saying this, I'm always impressed by the people who don't show up, because then you know where the barrier is. You know, if you call a meeting and a particular organization or a particular, you know, people in this slot don't show up, you know where you need to work. And you need to find someone and get them to be one of your champions so that they're part of the solution and part of moving forward. I work for an organization that is largely funded through federal dollars, but all of our work is done locally. We do a little bit at the state level, but most of it is done in local communities. And one of the things that as I said, I have one of the greatest jobs because I get to actually go to all of those communities and meet people and find out what's working for them. And I think that certainly Charlotte County and Punta Gorda is your similarities with other communities across the country are greater than your differences in terms of the source of some of the problems, some of the source of lack of funding, lack of insurance, uninsured, et cetera. But it really is, there's a willingness and a desire at the community level that really you can't replicate at the state or federal level. I'm not against federal dollars and state dollars at all. But at 35,000 feet, you don't understand, you don't see the families who've lost someone, who are struggling to hold on to someone. That's what happens, that's what community members can do, is to provide that face and that enthusiasm and that passion and that love for the community and for the people who are hurting, and finding out where like I said, where the gaps are. Because I really believe, and I think ARCHway is a great example, if people have the enthusiasm and the energy and the ability to network, you can really begin to bring people together and have those conversations about, in this case, how to address substance abuse and addiction and other behavioral health problems. I was at a conference the other day, and a physician who does a lot of medication-assisted treatment was talking about some of the barriers that his patients face, because there is a segment of the population who still believe that addiction should be something that's just sort of a tough love and scared straight kind of approach, that it's not a medical problem, that it's not a disease, that it's not something that can be adequately treated by medications. And he said that's one of the biggest barriers, because his patients want to recover. They're his patients. You know, they're in treatment, but they will go back into communities, perhaps into families, where they're shamed from participating in medication-assisted treatment. And despite the evidence that it's one of the best ways for people to recover from addiction, it still is seen in some circles, in some groups, as being something people shouldn't do, because it's, I'm using air quotes here, it's trading one addiction for another, which is not what the medical view is, and the evidence does not support that perspective. So there is a lot of stigma about treatment. There's still a lot of stigma about what causes addiction. Someone referred to it the other day as an injury. And I think that's an interesting way to think about it, because it does more than just make someone sick. I mean, it does more than just, having an addiction is not just having an illness, but it really does injure everyone who's in your life. And like most injuries and most illnesses, it takes a lot of time and a lot of people to heal that person, and a lot of support. We would no more cut off a family member who was suffering from another chronic illness. We would no more cut them out of our lives because maybe they weren't healing or progressing as fast as we thought they should. But that's something that we do with addiction and mental illness, for that matter. So I think changing the way we think about it, it's not a moral failing, it's a disease, it's an injury. It requires a lot of people, it requires communities to come together and really provide that support, not just in money, but in time and in sympathy, asking, what can I do to help? You're not asking, what's wrong with you? You know, why did you do this? Why did this happen? But how can I help you? Is a very different turn of phrase. It may seem like nothing, but it matters a lot. Because certainly people who have an addiction and are in whatever stage of their journey, they've been told a lot that they're doing a lousy job. They don't need any more negative messages from people. So just asking how you can help, or if you know a family member who is experiencing this, ask what you can do to help them. And it may be nothing at this time, but they at least know down the road. And that's one of the things that ARCHway, I think, is magnificent at doing, is connecting people. And that's something Dan and I have lots of conversations and emails about, and text messages, because that a lot of it is just connecting, because people who are in the middle of an addiction and their loved ones are disconnected. I mean, that's part of it, and part of it is the stigma. Part of it is just the injuries that come as a result of, to both the family and employers. Some of you who are employers probably have employees, and you've tried, you know, 1 time, 2 times, 3 times to support them, but it is very difficult for businesses too. It's not just a personal, doesn't have just a personal effect. So I guess my my bottom line message would be that the way out of, and the way to begin to address addiction and other behavioral health problems is really through community support. And that is talking about it. It's asking people if you can help, volunteering, volunteering to drive if you know that transportation is a problem. In the rural areas, volunteering to drive. Some of you might have time to do that. And we volunteer to take people for their chemotherapy. Why wouldn't we volunteer to take people for their medication that they're taking for their addiction? So it's essentially the same thing. Okay, so I think that it's having such a great turnout today and yesterday for the tennis tournament, I think is a testament that all of you care, not just because you're friends with Dan and Jan, although they can be very persuasive, sometimes arm twisting. But I'd like to really encourage you. I'd also, depending upon where you are in the network and framework in Charlotte County or Lee County, there are a number of free resources, free technical assistance that's available to work doing strategic planning meetings with communities in terms of addressing behavioral health issues, behavior addiction, addiction support, substance abuse services. And I'm happy to talk with any of you about that, give you some contact, contact information. There is a lot of money being allocated at the federal level for opioid, I'm not going to say treatment, but just generally responses to opioid issues. And it eventually needs to find its way down to the communities, because there's really nothing the federal government can do about this other than provide money and training. But it's done where the action is taking place is at the local level. So where I work, we have lots of contact in terms of knowing what those resources are. I'm happy to share that with anybody who's interested. The cycle usually is around September. The money becomes available September, October for the next fiscal year, and so and that's an annual, program. So thank you for inviting me to talk. I'm happy to answer any questions if anybody has, either now or afterwards. So any questions or no? Okay, thank you. I'm not sure how long.